We have microphones this time, which is great. Hopefully you can hear me. That's a little bit of an echo, so I'm trying not to use it, but if I need to, let me know. I'm happy to.
I can adjust it for you if you need me to.
Okay, awesome, great. And Tony has one as well. So the two soft speakers have a microphone. And I want to thank Supervisor Ferris for attending. Appreciate you being here. Before we go to approval of the minutes, I want to welcome the public to public comment. And to facilitate that, I want to just review the process for public comment, just so everybody's on the same page. And so everybody, any member from the public, whether you're in person or on Zoom, is welcome to participate as far as public comment goes. You also notice on the agenda, we've offered public comment after every agenda topic, and so we're going to encourage public comment more frequently throughout the meeting. And we're going to ask that you limit it to 2 minutes per comment per section. Okay. If there is something that is brought up that is a topic that is not on the agenda, we will ask that you bring that up during this first round so that we can, if there needs to be discussion or any determination, if we need to bring something back for a further meeting, that we could do so at that time. And then, anything that I forgot? Okay. Great, and I also want to acknowledge that we have a member participating virtually, that Dee is participating virtually. She's also a voting member. As soon as she gets on camera, then
Hi, Meg. Hello, team. I tried to get on camera, but it says it's disabled by the host.
Okay. Well, we'll let you guys figure that out, and hopefully that will take care of itself. All right. Thanks. All right. So, I'm going to open up to public comment.
I'm not sure if this is on the agenda anywhere else, so I'll just go now, if that's okay.
Perfect.
Wonderful. Hi, good evening, Chair of Blankenship and board members. My name is Stacy Frericks, and I serve as the president of NAMI Yolo County Board of Directors. Thank you for the opportunity to speak to you tonight, and thank you for your critical role that you play in advising the Yolo County Board of Supervisors. I'm here to respectfully urge you to use your voice to ensure that NAMI Yolo County is funded at the same level as last year. At the September 9th Board of Supervisors meeting, an update will be presented on the 2025-26 proposed budget for the Mental Health Services Act funding. While we don't yet know all of the details of the staff recommendation, we do know that revenues are declining and fiscal pressures are real. Even so, reducing funding for NAMI Yolo County would have an immediate and harmful impact on individuals and families that rely on our programs. Last year, with $197,000 in county support, we provided peer and family support services that reached more than 2,000 people. We offered free support groups across the county in both English and Spanish, responded to over 200 calls and emails through our helpline, and provided classes, presentations, and outreach events. And importantly, 100% of our survey respondents reported that our programs helped them feel less isolated, better able to manage stress, and more capable of recognizing signs of mental illness. These services are a lifeline for our community. A funding reduction would mean fewer support groups, fewer classes, fewer families getting the help that they need, at a time when demand for mental health services is increasing. I urge you to contact the Board of Supervisors ahead of its September 9th and 23rd budget meetings and ask them to retain full funding for NAMI Yolo County in the coming fiscal year. Thank you for listening and for your continued leadership in protecting mental health services in Yolo County. Thank you.
Good evening, my name is David Pinto, and when my daughter was 15 years old, it started with a panic attack at school, and then over the next few years, there was a lot of depression and manic episodes, and during that time, she tried to commit suicide 3 times, which required hospital visits. We as parents were beside ourselves, not knowing what to do and how to deal with the situation. Fortunately, someone who had experience with NAMI suggested that we attend NAMI Family to Family program. This is a 12-week program that gets families of folks with mental challenges to get together and support each other. The program was very effective, science-based, and taught us how to deal with our emotions and gave us practical steps on how to cope. As a result, we were able to take care of our daughter better, and I'm happy to report that she is doing well and has a good career in public policy and lives in New York. With NAMI's help, we did not feel alone and isolated anymore, as we saw the other folks dealing with similar situations, and we helped each other cope. These were folks from my own community, our own community, and by sharing our experiences, we realized how widespread issues of mental health is. This is the reason I decided to join the board at NAMI Yolo County so I can give back to my community. I would love to see resources and funding for mental health in Yolo County expanded, especially in these trying and uncertain times. Thank you.
Okay, so as someone who has previously served on this board, it's an honor to be here today to share my public comment in support of NAMI Yolo. When my daughter was just 7 years old, she had a psychotic episode and was diagnosed with bipolar disorder. My husband and I were thrown into crisis mode, of course. Friends didn't know how to respond, and many pulled away. We felt abandoned and alone. And then I found NAMI Yolo. A kind woman answered the phone and said, yeah, we have a basics class. I'll sign you up. And it was the first time when I took this class that I did not feel that as isolated. I sat in the room with other parents who truly understood. I no longer felt hopeless. I felt supported, educated, and empowered. The experience inspired me to give back. I became trained in NAMI Basics myself, taught 2 classes, and have co-founded the Basics Support Group with my co-facilitator, Joanne. We've done that for the last 3 years. Through this work, I've seen countless families experience the same transformation I did, moving from fear and isolation to strength and recovery. That's why NAMI Yolo is not just a program, it's a lifeline, and from a funding standpoint, it is also a smart investment. By providing education and support early, NAMI reduces costly hospitalizations, eases the burden on crisis services, and strengthens families before they reach the breaking point. Every dollar invested in NAMI saves money in the long run, and more importantly, it saves lives. As you finalize the 2025-26 budget, I urge you to retain full funding for NAMI Yolo. This is not just about dollars, it's about protecting families, promoting recovery, and building a healthier Yolo County. Thank you for your leadership and your commitment to mental health in our community.
Good evening, Jen Boucher-Dancer, Executive Director, NAMI Yolo County. I first wanted to say that Tony said I was not allowed back because everyone said their goodbyes to me last month, but I'm here once again. This really is my last meeting. My last day here will be September 30th. I did want to share that one of the things that we provide at NAMI that is really kind of an intangible is hope. And we hear it frequently from the people who contact us and who engage in our programs, that when they receive a mental health diagnosis or their loved ones, we often hear that people experience a feeling of what's going to happen next and a loss of hope. And through their connection with NAMI, being able to connect with other people who have walked a similar journey, we're able to give people that hope and for people to be able to see that you can live a healthy and fulfilling life with a mental illness. And as a family member, it's not, it doesn't have to be a catastrophic event that destroys your relationship with your loved one. So to that end, as you all know, on September 27th, we will all be walking for hope at our 3rd annual NAMI Walks Yolo County. We will be at Woodland Community College. We've got an expanded route option this year of a 5K in addition to a 1K. So if you really feel that you need to get your steps in, we have those steps for you. We would love to have you all come out and join us on that day. As many of you have been there in the past and know what a really wonderful environment it is and how good it feels to just be out with community members who are all showing their support for mental health. I also wanted to share that we have a family-to-family class that will start on September 9th. So we are currently taking registrations for that, and looking forward to providing another class for a group of family members who are looking for that support and being able to offer them that hope that I talked about. So thank you all for your work here, and I appreciate all of you and your service to this community.
Anybody online that has a public comment? Christine, do you have anything?
I don't see any hands raised.
Okay, all right, thank you. All right, so we'll move on to the approval of the minutes. Is everybody?
I've moved to
Oh, we're
approve.
sorry, approve the agenda, sorry. Yeah, I don't even have a message.
Sorry, I've moved to approve the agenda.
Approve the agenda.
Second, Jonathan?
All right. All in favor?
Aye.
Any opposed? Okay, so approved. All right, now we'll move to the minutes.
I motion to approve the minutes.
Okay,
Second.
all in favor?
Aye.
Any opposed? Okay, so approved. All right, so thank you. We'll move on to member announcements.
I have a question, and this subject may be coming up later, maybe at the report of our liaison from the Board of Supervisors, and it's more of a process question for how things are going to work on Tuesday for the vote. I'm guessing that subject might come up later, or maybe Supervisor Frericks will talk about that in his report, or if not, I want to find out how that process is going to work. I don't know if now is the best time for me to ask that question, or save it for later when it maybe comes up on the agenda, assuming it does.
Happy to address it whenever you want.
I'll defer to Supervisor Frericks.
Yeah, I mean, we have an update scheduled. Tony's probably going to speak to it a little bit as well as part of his report, but there's an update coming to the Board of Supervisors next week. I'm not anticipating any vote next week. It's an informational item. It will help to inform the sort of final budget preparation for adoption on the September 23rd agenda of the Board of Supervisors. But my understanding is that the presentation on next Tuesday is an informational item, but I could be mistaken.
My understanding is what the intent is to provide the board with an update and with potential options to consider,
Yeah.
right? With the idea of coming back at a later date that he received formal guidance from the board, right? So I think it's a situation where the board is probably not going to have enough time to digest it all and to make a vote. We weren't asking for the board to make a vote.
And the reason why I ask is we've heard a lot of comments from NAMI folks, and I'm assuming that staff, HHSA, is going to make recommendations based on what they think is the best option or options, and then it'll be up to the board members to vote either right along the lines of one of their recommendations or, not. Is that right?
I think that's, generally correct. But I don't know that we're going to be doing that next week.
Right.
But I think, so I would just, I don't know, and I assume, I shouldn't assume, but I assume your next part of your comment or question is around advocacy. And so I would just suggest respectfully that this board, also consider weighing in however you feel best you want to do that, whether as officially as a board, if people just want to attend, a couple people want to attend the meeting, if people want to make comments either in person or via email in advance, however you want to proceed. But I think that, I'm only one member of the Board of Supervisors. I think that the Board of Supervisors writ whole, though, I would say is probably interested in, writ large is probably interested in hearing from this body or, around your thoughts. Yeah.
Because I just want to say, in terms of what we've seen from NAMI over the years, I'm going to be very focused on something that I've hammered and hammered and hammered, and that's our measurable results.
Mhm.
What's our acronym?
Smart.
What is it? RBAs, yeah. And it's been so frustrating over the years looking at the reports for all the millions and millions of dollars of the funding that goes out to all these organizations. And most of the time you can't even tell how well they're doing because they don't do the RBAs in a way that really sheds light on their success. But I will say NAMI and a number of other organizations have always produced really excellent reports that shed light on how well they're doing and how many people they serve and help. And so I just, I may speak, but if I don't, since you're our liaison, I think you know that anyway, but if you can share that information with your fellow board members.
Yeah, I will absolutely do that. I appreciate that comment. I will just, and I will have a presentation, a brief sort of update from myself or from the board and towards the end of the meeting at the appropriate time. But that was already on one of my items was about data. So outcomes and data. So yeah, absolutely. So I'll expand upon more of that later.
Question on timing. Is the board anticipating having a vote before our next meeting, or if we were as a whole?
I would say so, yes.
So
Because
before-
we're making taking action on the upcoming final budget by the end of September, which
Okay.
would be before.
So
your
we
next
would need to
meeting.
do that today if this board was gonna vote on a recommendation.
Yeah,
Okay.
yeah, I would say so, yeah.
Yeah.
Yeah, but I mean, I think that, so not trying to influence one or the other, I don't know that you have to, you could you could do whatever you want as a board and take action if you want on a recommendation to the Board of Supervisors. I think, I'm not sure, I would just say generally, I'm not sure there's a recommendation to make per se yet. I don't know that I know what that would be, so let's say, yeah. But it might be well informed by obviously discussion tonight on other topics, so.
Okay, because I guess, well, my question is, what is the NAMI budget about? Do we know that?
Should we wait?
So,
Or wait?
yeah, let's
Or
have
is
it
that
wait
a
until we have the,
Okay.
we're talking about the budget as part of the director's report out.
I would just say that I'm not prepared to share any information about potential recommendations publicly just yet, right? Because I don't want to get ahead of the agency or put anything out there that I'm not ready to talk about it. Let me just put
I
that
think,
out
I think
there.
he's just asking what their budget is, but I don't
Oh, what
know
is
that
it?
Tony, I don't know that Tony would know that off the top of
No,
his head. Probably-
it's $197,000.
He does know.
I just,
Yeah.
Yeah, that's all I was asking.
That's all I'm asking.
Yeah.
What is the,
Yeah, and so it's currently $197,000 per fiscal year. That's what it was last fiscal year, and that was what the original budget amount was for this fiscal year 25-26.
Is it fair to say the recommendation from HHSA will be public 72 hours before
Yes,
the board meeting?
Yeah.
Thank you.
so and I'm not, just for the record, I'm not trying to be evasive. I was working on some of this stuff on Friday, and we still have some, our agency director and our assistant director are still working on the presentation with SAFE, but I've been off the past couple of days, right? So I don't know exactly where we're at just yet. I have a pretty good idea, but I don't want to speak out of turn.
Well, it's good to know that anybody on the board can look for, 2 days before as well and can show up in the meetings or send an email, or also there's many ways we can support. Okay, great, thank you. Chris?
All right. Modeling this great shirt. This is what volunteers wore for the Opioid Coalition HSA table at the county fair. And I'll say that we had these revival kits that were handed out, the state provides them. We distributed 150 of them at the county fair and 500 fentanyl test strips. A lot of advocacy, engagement, had to spin the wheel for prizes, ran out of prizes. I pulled a prank on Julie back there and changed it to fentanyl test strips, and Mark came, took a picture, and she freaked out a little bit. But anyway, it was hot, it was loud, we had a good time, and we had a lot of positive engagement with the community.
A lot of tacos. A lot of tacos.
Yeah. If you've been to the Holy Rosary taco stand,
Yeah.
I got too many tacos for our group. So we gave some to the people in the booth next to us. The agenda's changed a little bit, as you probably noticed, and so there isn't a criminal justice update, and so it's been covered in this part. There was a addiction intervention court graduation a little week ago on Friday, so that program is still moving forward, although new people are not really going to those programs, unfortunately, as this Prop 36 issue with the DA and public defender works its way out, unfortunately. I did bring this. Jonathan and I and Terry back there, Julie, we had the specialty court program. We always had a team for NAMI walks. And last year, this was the shirt you got for the $100 donation. My son told me that I was too old to wear something this bright. My wife loves it when I wear it when I'm walking in the morning on the streets because I move to see me right away. I asked Jim what color it was going to be. She couldn't give me the answer for this year. It has a nice light blue, and a navy blue that was more age appropriate for me. But we do have a team. It's the Wellness Warriors. Our team captain is Terry Backer, also modeling one of these really cool shirts. And so I invite the board to join our team. And for anyone, I know we have a recent college graduate who can't afford the donation for the t-shirt, I will pay for it for you so you can get one of these really cool shirts. So September 27th, hopefully you're all out there. I now have a bad knee, so I'm doing the short course. Something about a meniscus tear, arthritis, and all that. I'm getting old. And that's my update.
Do you want to mention the resolution?
That's going to be in the presentation. I think. I want to steal Julie's thunder. She's got a full picture.
Awesome, thank you. Well, I'll join you. Yeah. I don't look good in that color, but.
I'm not going to say I look good in that color, but there may be a different. Do you know the color?
Yeah, I'm good.
I'm sorry.
I can't remember.
Wow.
Well, no, yes. Yeah.
They will be
Anyway.
here in a few weeks.
I can send the link out to anyone who's interested. If you all should have my email address, email me. I'll forward you the link so you can sign up and join our team.
Now, what's the post-walk party location?
That's to be determined. I think we did Judy's Grinder once. The last one, which is definitely not a healthy choice, but it's good food.
They might have a scooter for you.
We don't need him in the scooter.
Probably take my license away.
Exactly.
Anyway,
All right, thanks. Appreciate it. Anybody else?
I am working on a new member onboarding packet. So then I attended a super fun California Association of Local Behavioral Health Boards meeting, long acronym. Anyway, they had a binder that had kind of like guidelines for local behavioral health boards. And I'm like, what if we did that, but for new members? So then I'm kind of compiling that right now and trying to specialize it to Yolo County, and hopefully we'll have that by next board meeting. And I'm working with Christina on potentially printing that out so everyone can have a binder of that by next meeting.
That's amazing. Thank you, Karen. All right, anybody else? All right, move on to the chair. Before I go into updates, I just want to say thank you to Tony and Christina for Tony and Christina revamped how they work with us and so that we can get the packet out to everybody the Friday before the meeting. And this was the first time, and so thankful that it came out. It really helps us to have a few more days to be prepared. So really appreciate it. I know that's a lot of juggling and hard work, and so I just want to say thank you. It's very much appreciated.
I think I was supposed to do that all along, but thank you for the grace.
Well, it showed up. So that's all good.
Yeah.
All right. Also, I wanted just to give an update for next meeting, and just to remind everybody that we have a data notebook that is required of us to approve. And this topic is wellness and recovery centers in California's public behavior health. Tony has offered to have a staff member who oversees that part in the county to give a presentation next meeting, because we need to approve the data notebook by November 1st, so we'll need to approve it at next month's meeting. So I just want to give everybody a heads up that will be the presentation for next month. And if you have any questions regarding the data notebook, you can certainly reach out to me. But there is a fair amount online under the well the Health and Welfare Code, so then if you have any questions, let me know. Everybody for that, and I think that was it. We can move on to correspondence. Do we have any? No. All right. Okay. Well, before we move on to a presentation, I just want to open up to public comment again to see if anybody has any specific public comment that they did not share during the earlier option. Great. Not sure if anybody online joined us who might want to make a public comment. Okay, great. Well, we have a presentation. Jill, is it Freitas?
Freitas and Glenn Johnson.
Great, Glenn Johnson. They're going to talk to us about substance use disorder and the system of care.
Why don't you write this? What's the best?
Probably
In the pit.
in the pit.
In the pit?
Yeah. They thought that, but it is
I'm kidding.
Have it right here.
right.
It's okay.
It's an entrance to the pit.
I have my screen so I can hopefully, or Glenn, I can.
Would it be easier if you guys were here, then I can move, because there's this seat right here. and
So
then
we
here.
can see our.
Yeah, you can see.
It's
and then
okay.
you can-
I have it right here too on our screen.
Are you
So,
sure?
Yeah, I think we'll be okay. Thank you. Thanks. Right. Oh, yeah, and are you gonna switch slides?
Just say next slide.
Awesome, perfect. Hello, we're here today to present the Yolo County Substance Use Disorder Continuum of Care. And we're from Health and Human Services Agency and the Adult and Aging Branch. Next slide, please. A little meet the team slide. So Tony's our interim behavioral health director. And my name is Julie Freitas. I'm the AOD administrator as well as a clinical manager for our SUD and forensic diversion services. And
my name is Glenn Johnson, Alcohol Drug Program Coordinator. Thanks for having us this evening.
next slide, please. Who knows about DMC ODS? Anybody in this room know about DMC ODS? I know Chris does. Okay. DMC ODS is basically the Drug Medi-Cal organized delivery system. We actually, it was part of the Medi-Cal, the Section 1115 Medicaid waiver that Yolo County opted into in 2018. And so it was kind of like California's innovative approach to providing specialty substance use disorder treatment services under Medi-Cal. So prior to 2018, we didn't have DMC ODS. And across the state, there are counties with DMC ODS plans, and then there are counties with regular DMC plans.
Yes, DMC.
And it's very confusing sometimes, like kind of the differences, but we're gonna go into a little bit about the differences. Next slide, please. So before DMC ODS, the traditional drug medical program was limited, only covering a narrow set of SUD treatment services. And individuals often face gaps in care, lack of access to residential services, and uneven quality standards across counties. Next slide, please. And so this is just a slide that shows like the services that were available before DMC ODS services there on the left, and all the services that have been added since DMC ODS was since 2018. And prior, before DMC ODS, we didn't even have intensive outpatients for non-perinatal clients. So all of the SUD system is separated into kind of like perinatal services and non-perinatal services. We have codes kind of for both subsets. And so you can see the withdrawal management, which is detox, the narcotic treatment programs, opioid treatment programs, medication-assisted treatment, clinician consultation, care coordination, all those, and recovery services, all those services were added with DMC ODS. Next slide, please.
Yes, okay, start this one. So yes, I'll start talking about pathways to connect to our continuum of care. Individuals can either call our access lines 24 hours, 7 days a week. They can walk into any of our 3 offices, which is Woodland, Fort Pierre, West Sac, and Davis, or they can be referred from a community provider for like their primary care provider, for example. Once the individual contacts the access point, they'll be provided with an assessment using the American Society of Addiction Medicine criteria, also known as the ASAM, and that will determine their level of care. And the level of care that we have connected to our continuum of care is outpatient, intensive outpatient, narcotic treatment programs, medication-assisted treatment, recovery residence, and residential. All of our services are 100% contracted out, and now I'll introduce our contract providers. Next slide, please. Okay. So for outpatient and intensive outpatient, we contract with CommuniCare, Ole Health Centers, and Granite Wellness Centers. CommuniCare is, of course, right here in our neighborhood. Granite Wellness Center is located in Grass Valley. Little components to outpatient, intensive outpatient, depending on which one you're on, it's the individuals will receive a certain amount of hours per week. And some of the components consist of course, the intake, individual counseling, group counseling, family therapy, patient education, medication services, and treatment planning. And one cool thing about CommuniCare Ole Health Centers is they have a Journey home perinatal program, which serve our perinatal clients. This program has been serving Yolo County, I believe now for 45 plus years. One thing that we love about it is clients that are connected to this program, they are offered transportation to and from treatment as well as childcare. So while they're receiving their treatment, there's a childcare facility there to watch their kids. So try to take care of any barriers to treatment. So that's one thing that we love about that program is the transportation and the childcare. Next slide, please. So for narcotic treatment programs, provide opiate medication assisted treatment to those addicted to opiates. And we contract with Core Medical. They have a location in West Sac and one in downtown Sacramento. One thing I want to share with you guys about Core Medical, each year we get audited by the state. And during our last audit, the state was very amazed and pleased with the turnaround for Core. Clients can come in, receive their intake, and get dosed on the same day, which they thought was amazing. You know, sometimes our clients have to jump through different hoops and different barriers, and if you lose them that day, who knows when the next time we'll see them. So with Core Medical, we're very pleased that they have that for our clients, and it's been paying off tremendously. Next slide. So for residential, we contract with Yellow Wayfair, also known as Walter's House. If you guys are not aware or haven't seen it, they just moved into a beautiful new facility. A lot more residential beds, which we really need in this county. We also contract with Granite Wellness Center, which is located in Grass Valley as well. And usually residential treatment clients are there between 30 to 90 days. They're reassessed every 30 days to see if they're still needed that level of care. And we also contract with Granite Wellness for withdrawal management services, also known as detox, but we're trying to get away from the word detox due to the stigma. But it's just observation and monitoring to evaluate the health status of clients during the detox process. And once again, we have that service provided through Granite Wellness and soon coming to Walter's House. Next slide. So recovery residents. This is a new service that we recently found some funding for. prior to recovery services, mainly it was to the probation, clients, but we found a funding stream that will, allow clients outside of probation to, participate in recovery service. And basically what it is when clients, graduate from residential care, a lot of our clients don't have a safe, supportive housing. So recovery residence is a place where they can go and integrate back into the community while they're still on their road to recovery. While in recovery residence, we assist them with searching for jobs, searching for housing, and just any barriers or any challenges that they may have while integrating back in the community. And one thing with that is they're connected to our patients still while they're in recovery residence.
It's up to.
Can I add a comment to that?
It's up to 2 years too that you can.
Yes, up to 2
You
years.
mentioned that, but-
No, 2 years rent-free. And
I just want to say the residential program sometimes is the easy part. It's what comes afterwards, that integration back into the community and those supports. I don't know how many times I've seen people that have done residential treatment before and it didn't work for me. No, it's that integration, which is why this part is so important. Because you're looking at someone who, if they need the residential treatment, they're probably going to need assistance for at least a year afterwards, getting back into the community, finding housing, finding employment, and beating their demons.
Yeah, and I think Glenn mentioned this, but if you are in recovery residence, you do have to be in some type of outpatient service as well. So that's part of the requirement of the program.
yes.
Which helps with what you just said.
And one thing to piggyback on with Chris said is we're very connected with all of our service providers. We have ongoing meetings, care coordination meetings. So when clients are getting ready to graduate or move to the next level of care, we're on top of that so we can direct them and steer them on to the next level so nobody gets lost in the system. So thank you. Next.
Yeah, so you said you found funding, you found a funding resource. Is that a permanent, is that a one-time funding or how are you?
It's opioid settlement funding. And so we do have it for several years out.
Yes. And contingency management is a fairly new service. It's an evidence-based treatment that provides motivational incentive to treat individuals living with stimulus use disorder. It's a 24-week structured program. Individuals have the chance to earn incentives through gift cards weekly as they meet their goals. Right now, we're running this program through Communicare and CORE. One thing about it, they have to be connected to another system of care and outside of residential care. And so it's been amazing hearing the clients, what they're saving their money up for. They get gift cards. Some people can cash it in that week. Others save it around Christmas time. It was great hearing the stories of clients saving up their little cards so they can go Christmas shopping for their kids. And just not too long ago, folks are doing the same thing for back to school. So it gives them some type of incentive, some motivation to work towards too, and it keeps them clean and sober at the same time. So it's a win-win program. We're glad that it was approved back in 2021, and right now we have 2 of our contract providers that is running. And next slide.
Right. Come to the Yellow Opioid Coalition, which is what we're representing today with our shirts, our The Lives Revive campaign. So the coalition actually started several years ago with when Ian Evans was here and Sarah Gavin from Communicare. They were co-facilitators. And then during COVID, it kind of just dipped out, right?
Yes,
Dipped
yes.
out. So Communicare and HHSA got back together again about a year and a half ago, I would say. We did actually a media campaign with Communicare, a youth media campaign, and that spawned this new energy behind the Opioid Coalition. So we are we have membership, family members, agencies, other providers. There's so many different people that are in the coalition. We have hospital staff. We have SUD navigators. There's just there's a ton of different people, but this was just last Tuesday But feels like the time is going by so quickly. This is a proclamation, the first proclamation for Overdose Awareness Day, which was August 31st. And I wanted to thank Christy Lee. She's pictured here. She's our coalition member, and she lost her son to fentanyl poisoning, but she started drafting the proclamation, and then Chris took it up, and then Jonathan took it up, and took it to Supervisor Villegas. And so our members, our family members got to receive that last Tuesday at the Board of Supervisors meeting. And this is just a little message about why we do what we do. It's super important to remember those that we have lost and carry that spirit. And that's the energy kind of behind the coalition. And so we just ramped up our efforts. Recently, we were at the fair. Today, we were at Recovery Happens in Sacramento at the Capitol. It's been really inspiring to have the group come together and work on this like specific campaign. So if you want to join us, let us know. We meet the last Friday of the month.
The fourth Friday of each month at the Bauer Building. We actually, at noon, we have options for folks to attend via Zoom if they can't make it in person. And so if you guys ever want to participate, join, please feel free to reach out. We've been picking up so much momentum within the last month or two. Like we've been at these events, we've been making contacts, we've just been letting folks know what services are available, what resources are out there, and that most importantly, we're there for them to help support their road to recovery. So that's Alive is the vibe, and we appreciate all the support that we're getting. Thank you, guys.
And then also just a few comments about fiscal year 24-25. We served 722 individuals in 24-25 and provided 75,967 services. And with a cost at $6.5 million invested for the county. And it was just maybe 35 to 40 people above last year. So it's like slowly increasing each year. And what was the other thing I was going to say? SUD will be included in BHSA, so we'll be kind of discussing that. It's allowed SUD to be expanded into the eligibility, for BHSA. And also we're working with Walters House right now. We have a behavioral health bridge to housing program that kind of took over some women's recovery slots in the same building. They were kind of like in the same building together. So we're opening up a new women's recovery house in the next couple of months with a grant that we received, and then ongoing it's going to be funded with opioid settlement funds. But anyway, it's going to provide just like extra women's recovery residents since those beds kind of got displaced in our move. And I think that's it. Next slide, please. Any questions?
Do you have outcome data? I mean, all of the numbers you serve, I'm assuming.
We do.
Okay.
Yeah, we have an RBA, and we have, we are just getting ready. I didn't put it in the slides this time around. We're just getting to the end where we collect all the data for this last year, but we do have all the previous years, and once that's put together, we'll be posting we usually do like last 3 years of data.
Your paths to care, I'm assuming are all self-referral, yeah? Any outreach that's provided, like if a family reaches out, does anyone provide outreach?
Yeah, so just a quick note, the 2 people standing up here are the entire SUD system right now.
I can imagine.
We are it, however, we do have a kind of a vacant SUD peer support worker role, but we do outreach. And for example, like our whole, one of the basis of like us doing the Recovery Happens event today was we're trying to talk to people, right? Get them interested in services. We have our brochures. We're doing that kind of education and resource material.
Thank you.
Is
Is there a connection with the schools?
So we do, yeah, so Friday Night Live is part of our coalition. And also we're connected with the Healthy Schools Collaborative. And so there's some integration in both of those areas. And when we were at the Yolo County
Yes,
Fair.
at the fair, we can't think of the name of
Lee
the
Middle
school.
School.
Is it Lee? Yes, Lee Middle
Yeah.
School. They want us to come out and do a presentation, so
Yes.
we'll soon be out making our rounds out there to school.
The more we're in the community, the more people see us, the more visibility it has, the more people want to interact. So
Would
it's
you
good.
consider like presenting at a counseling, like if it's a district-wide counseling meeting?
Oh, yeah.
to all the
We'll
counselors
position
on
you
site?
Of
where we
course.
can get the
Yes.
information.
Okay.
Yes.
Yes.
Cool.
I think getting the information on the fentanyl test kits
Yeah.
into the schools is key. Because kids are experimenting with stuff, they don't know what they're getting.
Yes.
They get the wrong batch and they're dead.
Yep.
Yeah, we didn't talk about that, but we have the naloxone program, naloxone project, where we get free Narcan from DHCS. And just ordered a new bunch that's coming. And so we get free test strips and free Narcan that we can pass out to the community. We do ask people to take a training and collect some data for us, should they happen to use their box.
Is that an inhaler through the nose or?
It's
This thing right here.
It's the nasal.
There's a QR code. You just use your phone, get the information. And it's important that the information be collected because if the state doesn't get any data, how they're being used, they may not keep funding it. And I would assume you guys could distribute to the schools too.
Yeah, so they have their own distribution program.
Okay.
Yep.
Yeah, just thanks so much, Julie and Glenn, for your presentation. Just two quick questions for you. One, I think is on the services and providers slide. So, Communicare Olay, Journey Home, and Granite Wellness Center. Glenn, you specifically mentioned Communicare Olay, is obviously they're located right here, nearby, but do they also provide these same services in either West Sacramento or their Davis locations as well, not just Woodland only?
Oh, yes,
Okay,
sorry about that,
great.
yes, all three cities. Yeah.
Okay, great, that's great, thanks so much. And then the other question was, just actually back to the chair's original question about the recovery residence item and sort of, mentioning a new funding stream, and you sort of, I think Julie mentioned the opioid settlement funding. I mean, you said one time versus ongoing or something, is that, it is a finite amount of money, I think, but I'm not sure about that, I don't recall exactly. And so just a question around that, how did you all decide to sort of offer a new service potentially when, there are a lot of existing services that are having challenges being funded, so curious about that.
Yeah, so for opioid, first of all, it's specifically, that's a new service because it's going to be a new program now, right? A new program location. In terms of using the opioid settlement funding for current services, they actually discourage that. They want people to expand and create new services. And so we don't want to supplant like any funds or any existing funds.
Yeah.
So in the creation, in the spirit of that, right, and using the money to the best of our abilities, we have done that. But just to answer your question too, in terms of like how much money, so it's a very fluid situation.
Yeah.
When we first started, we thought we had like a little over 350,000 per year, and it was going to go out for, I think it was 17 years or something like that. Keeps growing because there's new settlements like all the time. In fact, Sandoz has a new settlement. County Council is taking that to the board this month.
Yeah.
And so that amount just keeps like incrementally growing, and as it grows, we're watching it. And the thing about the opioid settlement funds is that you have 5 years to spend the first year's allotment.
Yeah.
And so you always kind of have to keep track of it and be able to spend that down so that you don't lose your funding.
Yeah. Thank you very much, appreciate it.
Is there outcome data associated with that? Do they ask? I'm assuming that's part of your.
Yeah, so it's kind of different in the way, like we have to do an annual report for DHCS, so it's a little bit different how they do the outcome different. It's like very fiscally focused and program focused. Yeah, so it's a little different than the RBA style.
So
But
they're
we do-
specific, okay.
Yes, very specific.
Is there any discussion, on using some of the funding for a treatment piece for those that are in Prop 36, criminal justice involved individuals with substance use disorders.
I think that, but it's not like off the table, you know, in terms of, it's just that like, that we would have to, that's like a bigger amount of money that we wouldn't be able to probably then fund all the other things. And it has to be like specifically oriented towards opiate abatement, you know, so like if a program came along and they were like, we're gonna create an evidence-based program focused on co-occurring disorders, we could fund that, right? Because it's within the allowable expenses, like there's a whole list of allowable expenses. So it's not off the table, it's just more of like, we have to have that conversation, and we haven't had that conversation yet.
I don't see any hand raised, but I just want to make sure no one online has. D or Nikki, you don't have a question?
No question. Thank you.
Thanks. And then I guess, is there anything you'd want the board specifically to know or we could do that it wasn't included in your presentation?
Yeah, I mean, I think that like just the SUD system, you know, in general, it's kind of historically always been like a little kind of, you know, stepbrother to like the mental health system. And as we're out there and gaining more visibility, the state, you know, we're gonna go into integrated behavioral health next year in 2026. So the state's really looking at just making one, you know, both systems integrated. So we're looking forward to that. It's a lot of work because they've always been kind of siloed systems. So I think advocating, you know, for that and advocating for people in general, like the stigma is still so high. And we know that when we're looking at data, we're only touching like a very small percentage of people. And we want to figure out ways, that's part of the coalition's thing right now about trying to like figure out ways to really get at different communities that we're not reaching, because the people that are coming to our doors are the people coming to our doors, right? But what about the rest of the people? So we're looking at that. So, yeah.
The stigma's a big issue because medication-assisted treatment, you know, taking some of those drugs, methadone, there's a stigma with that, but methadone helps people. You know, there's no stigma for someone who's a diabetic taking insulin because they need that to live. But these medication-assisted drugs, they can get them into jail now, so they come out of the jail and seamlessly transition into services in the county. And one of the time frames for people most vulnerable to an overdose and a death is coming out of incarceration. And so that started about 2018, 2019, when the drug Medi-Cal, which really opened up treatment. We saw the criminal justice side, all those individuals were eligible and they had funding. And so it really worked great going into COVID. Then I kind of got messed up a little bit with COVID. And now there's a wait time to get into the residential program, so that there's more demand than there is supply for residential treatment. But two classifications, people go to the front of the line, pregnant women go right in, and also someone who's an IV drug user with most at risk.
And daily fentanyl use.
Fentanyl, also 30% more than that.
Is there any money earmarked for preventative, meaning, you know, hitting, you know, I don't know, childhood, what the evidence shows, but is there any?
There is. So the substance, what's it called? Substance use block grant, substance use sub-G now, it used to be SAP-G. They have, most of their funding is towards prevention and intervention. And that's the whole Friday Night Live program that we have, you know, in the county. Yeah, and then also some of our efforts for the opioid settlement funding are going towards prevention. Yeah, and we're taking a closer look this coming year at all the different funding categories for that and zeroing in on the programs that we do have and then trying to figure out how to expand some of those.
Yeah, that would be great. Great, well, thank you.
Yeah, thank you.
Thanks for coming, appreciate it. Thank you. Thank you.
right, so we're gonna move to behavioral health director's report, but before we go to that, I just wanna open up to public comment, but given that this is, you see the agenda looks a little different, we've listed out all of the topics on the report out. So if anybody has a public comment related to specific agenda item, if you could mention that in the report. Otherwise, if we don't have anybody in the public that has a specific question or would like to hear an update on the topics that are listed, we're gonna, basically the board pulls items off the agenda. So you may not hear an update on every single item. So I just want to make sure everybody, that you guys have that information before, when we open it up to public comment. So. Anybody? Let's see, hands online. All right, so what, for the board, would we want to pull off? What items do we want to pull off for?
C.
C? Okay. D? Sorry, D?
Yeah.
Okay.
Aye.
Aye. And G. And then Tony, on the annual update, would that include the budget, or where would the budget be on any of these?
I can comment on it there if you'd like.
Okay.
Yeah.
All right, so who pulled off C? Do you want to ask a question?
Yeah, that was me. I just had a question about the timing of the meetings, Tony, because they're from 3:30 to 5. We know in the past that when we've timed it that way, we've mostly gotten people that they're there for work.
Mm-hmm.
So if you're trying to reach the broader community, is there any way we can have them at different times or something like that so that we can involve more people?
Yeah, we can absolutely do that. I mean, this is the kind of kickoff event. But we can, I mean, we've already announced it. And so
Oh, yeah, I
it's a
don't
little
mean
bit
changing this
changed,
one.
but we can,
Yeah.
we can definitely have the meetings occur in the evening, like after work hours, just to make sure that we're getting more public participation. And yeah, absolutely.
Or even if it's like at noon, but an hour-long meeting so people can attend on their lunch breaks, that's
Yeah.
just a
Yeah,
rough time.
I mean, really the intent is to engage the community, right? So, you kind of get in this weird, you want some people to participate who are, like part of the professionals or whatever, right? And so you want to try to schedule time for them to participate as well, who may not be as inclined to participate after 5 and then at the same time they need. So sometimes we try to set it up to where we might have it go like 4 to 6 or something like that. But definitely the future events that are going to be a part of the HSA community planning process will include time that it's considering that people are working.
Thank you.
Yeah, thank you for pointing that out.
Okay, so I'm gonna pull off the agenda items and then we'll round back to the
Sure.
budget update at the end.
Sure.
All right, so C, C. Kimberly, did you have questions on crisis now?
I didn't have a specific question, I just wanted to kind of follow up with any updates.
Which did you, was it B that you were asking?
Yes, B, crisis.
Okay, all right. There's no real update right now, other than the fact that we're continuing to work on trying to obtain a vendor to provide after-hour home crisis response services. We did release the RFP. We did not get we did not get a bid, essentially. We did not have a vendor who was willing to do what we needed to do. So we re-released the RFP in the hopes that we've had some interest from some different parties. And so we re-released the RFP and we're hoping that we're going to be able to select a vendor that will be able to provide that service after hours. We've been using AMR for some time, but that was never intended to be a permanent solution. That it's pretty expensive to use AMR, even though they've been great. I mean, I got to be honest with you, AMR has really been great, but the model is really difficult to sustain, just in terms of the fact that it's AMR is very expensive and it requires us to have staff on around the clock as well, right? So ideally, if we had another vendor who could take on all of it, that would be a more ideal solution. And then the other part is that we're continuing to work through the process of developing the contracts with Safe Harbor and with the facility in Sacramento as well. And then I heard that there were requests for data, so I tried to put data in where I could in case, and so if you have any questions about that, please let me know.
Thank you.
Yeah, no problem.
Any other questions around crisis now? All right, so we'll go to G, community assistance.
Yeah, I was just curious, with the care reports, it says that there was 15 petitions and there's 5 active cases, and I was just curious what that means and what happened to the other 10? Did they just fall out or?
I'm gonna phone a friend. Julie, you want to speak to that?
Yeah, sure. Yeah, so with care court, it can mean anything like a petition came to the court and then the court ordered us to do a report, and in the interest of trying to, find the person or do a report, there's maybe like something that happened that could be like one scenario if they found missing or something to that nature. There could also be situations where even though the court determined prima facie, the treatment team actually was able to voluntarily get the person to accept services in another way. So you'll see all those cases kind of like drop out that way. And the ones that really go on to be more of the active cases are the ones that we're either really still trying to actively engage, maybe having some struggles with that, or they really need kind of like more of the structure. So we've been pretty fortunate to have a lot of people go the voluntary route, and then the judge usually dismisses the case because of that. So, yeah.
Are they, those 5, would they be like in a treatment then?
What's that?
Would it, the 5 the cases, the active cases, is that like treatment?
They can be in all different levels. So like I know right now we just got a brand new referral. So we got one of those 5 is somebody that's like brand new that was just like doing assessment work right now. Another person is almost to graduation. They've already had a care agreement and they're moving through the system and should be graduating soon. And then the other one person's like in a treatment program and some other, so there's just like different stages right now. Hopefully that answers the question.
That actually, 5 sounds good. There was a report that came out, mentioning Gavin Newsom and the goals that they wanted for CARE Act, and the program appears to be at this point not looking too good. There was like 500 something petitions filed across the state. There was more, but only 520 something active cases. So for Yolo County, our small little county, to have 5, I guess that's pretty good.
It's interesting because we were on the panel, actually a NAMI panel with Solano County, and Solano said, how have you gotten so many cases? Because they were like 2 or 3 or something like that. So it's just interesting county to county. It's a lot, I think, to ask people to come to court. And it's not the way I don't think that you'd really want to treat folks, right, with any kind of mental illness. And so it's an interesting program. That's all I have to say. Like, it's like, AOT, a civil court process. But it doesn't have any teeth, right, to make, like, judge can't like order certain things. So it's really, our goal is to like do the best we can at engagement to get people into services. And that's the best shot, I think, that we have.
So first off, I bet a lot of it's about marketing. You've gotten the word out, because that was one of my concerns.
Yeah.
I think that's been a problem with AOT too, is that people don't know about it. So that's great. The question I have is, when you talk about the person saying they're willing to engage, and we all of us, or most of us know that when someone gets to that point where their loved ones or a therapist or someone is making that referral to care court. I mean, how many times have they tried to get that person to engage? We also know that people who are ill can also be very smart. And they'll say what needs to be said on 5150 or whatever it is, and then nothing happens. So when I hear that, my concern is after all that work that people have done to get someone into care court, which honestly, I mean, I don't know, it doesn't seem all that onerous. Probably isn't that onerous for the person, the family member making that referral, then to just dismiss it. And sometimes, I mean, it seems what you could do is you could have a judge at least hold it. I don't know if you can't do that.
No,
Okay.
so we don't actually get to determine what the judge does. The judge determines, and Laura can speak more to this because Laura sits in court all the time. The judge is the one who is very, he's deciding, I'm saying he because it's a he in this county. He's deciding who gets dismissed and who doesn't get dismissed. So we're gonna present our case, like our report, right, that we've discovered. And usually when I say like people are going voluntarily, it's because we have created an avenue for them to go into services. However, if somebody goes into court and they're refusing, the judge will say, care court is voluntary. Right. So part of the eligibility criteria is that you are accepting this service. And if they're absolutely refusing after several attempts at different, types of engagement, they can move to dismiss, and they have. Like there's one particular case that they just decided to dismiss.
Who's the judge?
And then usually, and then usually that person goes to, like one person we had went to FSP after that. We're still trying to engage, so.
In-person towards conservatorship,
or moves towards
conservatorship.
Yes.
So the part about it being,
It's not an easy answer though, right?
Huh?
It's not an easy answer.
yeah, well, I was just gonna say the part about it being voluntary and, depending on I don't want to say dependent, it's just so that the client, being willing to accept the services is sort of like a double-edged sword. On the one hand, if they don't want to receive, if they don't want to agree to consent to services, it's like, well, we'll dismiss for that reason. And if they do, it's like, well, then why do we, they're agreeing to services, so why are we keeping this open that way either, right? So, it's kind of, I think it's more interesting that we have some cases that somehow remained open and when you consider those circumstances.
Yeah, and I think I would say like for that, the case in particular that I'm thinking of that has remained open, it's really served this person. Like care court has really actually like done, I think, what it was intended to do. And so, and I would say the same thing for somebody else who like decided to go the voluntary route, because really that's essentially, it's just like a route to treatment. It's supposed to be another route to treatment.
Any questions on? Okay. All right, so I pulled up Children's System of Care updates. I'm just curious where your sense is with that, especially kind of the budget cut, with the budget where we are.
Are you talking about the MH mental health law training?
Yeah.
So the good thing about this is that we, when we did the K-12 school partnership, we have the MHSSA grant, right? So we have two different funding sources. We have Mental Health Service Act dollars and we have the grant dollars, right? And so when we've been receiving consultation for the past couple of years, encouraging us to pursue mental health, medical, administrative activities as an additional funding source that they could potentially generate revenues for some of these activities. And so with this particular project, we're using some of the grant funding for this particular contract, right, for the consultant. We're pretty confident that we're going to be able to generate enough money through mental health law, that it will, it's gonna be an investment that ends up being paid back, right? So, I'm not too, I think that this is something that behavioral health in the county needs to do to learn how to generate more revenue. And I believe it's a worthwhile investment.
And are there preventative services in that as well?
No, this is solely based on, there's like a way for us to draw down Medi-Cal revenue for administrative activities. So it's essentially, there are activities that we are currently doing that we could be pulling down Medi-Cal dollars for that we're not, right? And part of it is just because there hasn't been some institutional knowledge about how to do some of that work. And so we have this consultant who is gonna help walk us through it, set up the whole system for the claiming, and then kind of help us navigate the claiming process and get it set up for us to move forward on it. But there's no direct services that are provided as this is a purely administrative function.
To hopefully improve funding.
It'll just bring in, it'll bring in more revenue to offset, at least, ideally it would offset overhead costs, right? You know, we do some administrative activities currently, but this is another potential funding source that has been, you know, for one reason or another, there hasn't been an interest in pursuing it in the past. But I think that we're at the point now where it's like, okay, we're gonna look into every potential revenue source that we can.
Can I ask, do you know a lot about it? Like, is it similar to ESMA? Are they using a random moment in time survey, or is it?
I gotta be perfectly honest with you, I'm not completely familiar with what the mechanism is, right? But I'm assuming that there's gonna be some similarities to it, right? I know on the school side, it's a little different, but I believe it's similar in the sense, like what I've always heard from the schools is you have to do all this work, and then you have to wait, you know, for the money to come back.
Yeah, it takes like
right?
a year and a half for the reimbursement.
Right, and so I believe that previous administrations have been like, this is just not worth it, right? It's not worth it, there's a lot of, you know, the juice isn't worth the squeeze, so to speak, right? But I think that we, as a county and as an agency, there's been some different things that we passed on, right? Just because it didn't seem like it was worth it. And I think that now we're, you know, finding out that we probably need to be doing things like this.
Yeah.
But to your point, like, I don't know, I'm not familiar with all the mechanisms of exactly how it works. And that's the whole point, is to pilot it. We want to pilot it with our children's program. We have, one of our managers is really invested in kind of figuring this out. And then the idea is to branch it out to the rest of the agency if it's successful. We believe that it's a potentially, and I don't want to get too far ahead of myself, but what I'm being told is, you know, more like in the millions of dollars, right? You know, so as soon as I have a little bit better idea about the mechanics of it and what the realistic projection is, then I'll bring it back for sure.
Moving on to. So
Yes, are there any counties that have actually successfully implemented SB 43, kind of a model for success for what you're looking at doing?
I know San Luis Obispo and San Francisco were the two counties that implemented it right off the bat. And then Sacramento opted in as of, I think it's January of 2025. And so we're kind of looking at San Luis Obispo. San Luis Obispo's similar size to Yolo. Yolo County has 220,000 residents, and I believe San Luis Obispo has 280,000. Right, they're close to the same size. And so our public guardian's office has been kind of connecting with them to try and get a better idea about what they've been doing. What we're hearing from them is they've really only had one case so far. But yeah, I mean, there's not a whole lot to pick from.
Right, and as far as facilities, a person you place in, it's gonna be a different treatment regimen. Are there any facilities that are up and running statewide?
So there's a facility in Sacramento that I went and took a look at. that it was being revamped from a skilled nursing facility into a facility that would be appropriate for this. And the department, DSH is taking up most of the beds. Sacramento County is taking up a large, so DSH was taking like half of the beds. Sacramento County was taking another quarter of the beds, and then it was sort of county to county for the remaining 25% of the beds. And it's expensive. That's all I can say. It's like it's more expensive than any of the other places that we're looking at for replacement currently. And so one of the challenges for us is really going to be around budgeting it and trying to make a realistic projection of how many cases we're likely to have and how expensive it's going to be. But yeah, it looks like it's going to be more expensive than some of our other residential placements because it's like a locked facility.
Okay.
So, when you're talking about beds, are these exclusive like substance use beds or like mental health?
They're not exclusively substance use beds, but they, in the particular facility that I'm talking about, it's not exclusive to substance use, but they can have substance use clients there as well.
Okay, yeah, because I know at least anecdotally, there are substance use clients that are in regular psych facilities, but then they're there due to substance use. So, yeah, just trying to clarify.
Yeah, the other piece was the facility that we were looking at that, I mean, it's in Sacramento. It would be ideal for us if we can figure out the cost, right? Just because it's close. We have a tendency to sometimes send people a little bit further away, right? Which isn't, it's really not what's best for the client, I think, and really not what's best for clients' families. But we also were looking at this particular facility because they can also take Murphy clients, which I don't know if everybody's familiar with what that means.
What's that facility?
I can't remember the name off the top of my head, but I can get it for you.
Where is it though?
It's in Sacramento.
Oh, right. I know what you're talking about. Yeah.
What is a Murphy client?
There's Murphy conservatorships are when we have a client who's on a conservatorship, but they are in a situation where they're, considered to be violent, but they're not competent to stand trial. And there's a lot of complexity around those cases because of some recent appeal courts rulings that are saying essentially you can't house Murphy clients in a jail. But so we have some of these clients that are in jails and we're trying to get them into like state psychiatric facility and that there's waiting lists, right? So you get into a lot of these dilemmas about, okay, where are we supposed to serve these particular clients, right? And so this facility was one where they could serve both Murphy clients, it could serve SB 43 clients and other types of clients. And so we're trying to figure out whether or not we could use this particular facility, but so far it looks like it's going to be pretty expensive.
More expensive than DSH, Department of State Hospitals? Because for the LPS, the county pays, right? As opposed to the IST. So the county's paying anyway if someone's going to a state hospital. Is it more expensive to send them to a state hospital, assuming they can get a bed, than to send them to this place?
I think that the challenge with the state hospital is I don't think we can send SB 43 clients to
No,
state
I'm talking about
hospital.
Murphy.
Yeah.
Right.
So for Murphy, I don't know, I haven't compared them to state hospital. I've only been comparing them to other residential facilities, right? But you're probably right. I mean, the state hospital is probably more expensive. But there's waiting lists, right?
Yeah, you can't, so very quickly, there's LPS, the vast majority are not Murphy, and they're not generally violent. The Murphy are a small percentage, and they're treated the same with the Department of State Hospitals in that even though they're in the system because they are in the criminal justice system, and they're very, very, very ill and very, 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 very violent. And until recently, the beds weren't available. And someone goes LPS, they stay there for a while often. Beds aren't available, And so they were sitting in the jails, which isn't a good place for them, but there's really no other place. And what Tony was referring to is a recent ruling saying, basically jails aren't the place for this population, which is true, but there's no place to put them. So that's what's going on. There's a lot of challenges with that going on statewide right now.
Yeah, there's a lot of competition, like, I don't want to call it competition, but there's like a lot, all the counties are kind of looking at all this same facilities, and there's just not enough beds for every client in the state.
And by the way, that's Carlene's new job. That's what she does now for the agency that negotiates on behalf of the counties for beds at DS, Department of State Hospitals. Carlene now does that. I called her and said, how can I find out how this works? And she said, it's me. So that was really nice, and she's been helping us try to navigate that.
Yeah, I know some DSH patients are put in like certain wards of private psych facilities. So for example, like there's several wards at Sacramento Behavioral Health, like the newer psych hospital in Sacramento, where several wards are DSH patients. So like I'm just trying to kind of understand how this is all fitting in.
Not a photo burn.
Go ahead.
So that's different. There's a couple of different units over there for DSH clients. And so one is a competency restoration unit. So they are actually going there to be returned to competency. And so they have that unit over at Sac Behavioral Health. They also have a unit, so we have a community-based DSH program that we have 10 individuals in. And oftentimes we need them to have some stabilization before we place them in the community. So they'll go from the jail to Sac Behavioral Health, where they can stay for an extended period of time. It's not like a normal, like kind of 5150 hospitalization, but they can stay there for an extended period of time while we're getting them stabilized on medication and prepared to be able to be out in the community where we can serve them effectively. So they have those two pieces that are at Sac Behavioral Health Hospital.
Thanks for clarifying, because I know there's a lot of different programs that kind of seem like they overlap, but yeah, I appreciate the clarification.
And once the 10 that go into that program, it's a diversion program, so they'll actually get dismissal at the end if they're successful. And that grant, I believe, gives more money per patient than you'll see for FSP type client. So it's fairly well resourced all the way from 2 years to a year and a half, unfortunately.
That's not totally true, though. We can still keep them for 2 years if there's a justification for it.
All right.
So, which is, we found that out recently.
All right, any other questions for Tony? All right, thanks, Tony.
Did you want to talk about the budget?
Yeah.
How may I provide you with excellent customer service?
So this board submitted a letter on June 5th, for those of, most of us that were members back then, I think almost everyone, encouraging the board to strongly consider the RBAs. And I just pulled up that letter, and I'm wondering whether we should kind of refresh it and have our chair like resubmit that, noting that the issue was on the table back then, but now it's, back on the table in terms of the board making decisions. And I don't know, maybe Supervisor Ferricks can fill me in, but I'm guessing that when these letters come in, they kind of, for a lot of the board members, probably not Lucas, but they kind of fall by the wayside. So it might be a good idea to send it to the board clerk again, so it's kind of front and center again. I don't know if that always.
So we have a motion.
I don't know if do we need one to just resend the letter? We've already voted on it. I mean, I don't know.
Well, yeah, I guess, do we want to tag on something else in there?
Well, then we would, because I was thinking to make it simple, it would just be, this letter was sent to you by the past chair, signed by the past chair.
Right.
I'm resubmitting it because I understand, Health and Human Services is going to be presenting on it again, and you will soon, later this month, in all likelihood, be voting on it. But if the body wants us to do something more, and we want to either vote on not doing something more or vote on doing something more, then we can.
I think it might be helpful if we gave the executive committee discretion, if there's new data, to include in that letter, that they, in their judgment, would then include it and update the letter.
Well, there's not really new data. They'll have the data. I mean, the
Okay,
data
there's
is the
new
data.
information.
It was kind of a very generic, we made it very generic, because we were encouraging Tony and his staff to really consider RBAs because they had certain criteria they were looking at. And so we just wanted to remind or emphasize to HHSA in making the recommendations and Board of Supervisor members in making decisions to really strongly consider RBAs. Because I want to say to Tony here, when you're making recommendations, I really hope it's merit-based. I know it's a hard job you have, partly because every supervisor has their constituents. I get that. But I just really think it's important because as I've seen over and over again, where we were giving hundreds of thousands of dollars to these organizations, maybe they're doing great, but we don't know if they are or if they're not. And it maybe was okay to do that early on because we had a lot of money and we, it wasn't as competitive, but it's not the way it is anymore. So I really feel like that's something that I'm hoping that is going to be, one of the top criteria when you make your recommendation, Tony.
Yeah, so the presentation that we're preparing for the board does consider all of the board's priorities that were established at the presentation or at that board meeting on June 3rd, right? So it was around primarily serving medical beneficiaries, maximizing Medi-Cal billing, outcome data, like the number of individuals who were served, and the materials that we're preparing for the board to consider capture all of that information. The reality is that the amount of money that we're talking about is pretty substantial, right? And it's like a pretty significant portion of the budget that we would need to scale down in order to address the structural deficit, right? So it's going to be a very difficult decision. That I think that is just an understatement. I don't think my job is just not as difficult as Supervisor Frerichs' job, but to your point, the materials that we're providing are considering all of that, right? And we're trying to give the board as much information as possible that considers all of those different factors, so that when it does come time to make a decision, it's a well-informed decision.
Hey, Christina, do you have that letter by any chance? I found it and I was trying to resend it to you so you have it. And unfortunately, it keeps getting bounced back.
You tried to send me something, I guess?
I tried to email it to you so you could maybe share it.
What's the date on it? And I'll look.
The date, well, there's an email I sent you. I'm sorry.
So I think, I guess the question I have is that we talked about, right, using metrics, I think is important. What I'm hearing is that metrics may not be enough, right? You're going to have some programs that have really good metrics and there's just not going to be enough funds to go around, even with those great metrics, right? And so, well, I think that it's still an important letter and it's still an important part of how we make decisions. I'm wondering, do we as a board feel strongly about something else that we want to add into the letters, knowing that? I apologize.
One word they mentioned is the Medi-Cal billing, efficiency in Medi-Cal billing. Are these organizations maximizing the Medi-Cal billing, get that money back? And I think some may be, some may not be, but I think that should be a criteria. That's my opinion. And I think I've already heard that's already one of the board's criteria, I believe, too, already.
That's correct.
Is that complicated though? Because if you're contracting out and they're doing their own billings, their own billing going back to them, it's not going to the county.
So the way that when we contract with a provider, they bill Medi-Cal through us, right? So they submit their bill, they submit an invoice to us with Medi-Cal billable claims, and then we submit those to the state for reimbursement.
Okay, so that's.
Yeah, so it's not, It's not a matter of them settling up with Medi-Cal on the side, they go through us.
One of the issues with the cooperative was the inability to do that through the county, because it's too hard to do it, so then they didn't want to do it.
Right. Or it's just cumbersome, right, and hard to like prioritize when you're
So
serving clients.
historically, I think what has happened is, and I certainly don't want to, I don't want to say this in a negative way to our partners, our contractors and partners, because even internally, like we have internal programs as well that use MHSA that have not historically billed Medi-Cal as efficiently as you would hope, right? But, you know, like you could say provider X, you know, has a contract with us and they can be reimbursed whether they bill Medi-Cal or not, because MHSA doesn't require Medi-Cal billing, right? And it just may be easier not to go through the process of doing all of the strict documentation guidelines and everything that you have to do in order to bill for Medi-Cal. We've had situations where we have providers who submit stuff to us and we submit it and then it gets denied because of some sort of an error or just some sort of issue, and then that billing is disallowed. And so it's like almost like there's a perverse incentive not to bill, right? If it's just easier not to do it, right? And so like over the past couple of years, what we've tried to do with many of our contracts is cap, right? And say there's only so much funding that you can receive that where there's no billing that's connected to it. You have to make up the rest in billing, right? And we've increasingly tried to move in that direction to incentivize billing Medi-Cal. Just because it's a missed opportunity, right? There are going to be some times under MHSA where there's some populations that are being served, which for one reason or another, the service they're providing may not qualify for Medi-Cal billing. And it makes sense for us to have a certain amount of like liberty around those services and not to make it where everything strictly has to be billed by Medi-Cal, but we really need to like increase because we're not leveraging those dollars as effectively as we should be.
And hopefully the innovation fund for that new program will help that make that easier.
Innovation funds, not necessarily.
Didn't you, isn't there a program for billing that's
Electronic health record.
There's an approved innovation plan, but we're not at the point of implementing that currently.
So just in the interest of time, I'm wondering if we could take that letter, maybe we could come up with, the executive committee could come up with some languaging really around what we've heard tonight, really, you know, looking at alternate ways to increase funding. I know that's not something the supervisors need to be told, but I mean, just to
I think
reinforce
it's important to hear, yeah.
that
Sure.
grants, things like that how can we fund things in an alternative way, you know, in other ways? And then potentially, how do we look at, programs that serve the community, that may be preventative in nature as well, you know, from our public comment. So,
The other challenge, just to put it on the table, right, you know, is we're trying to, as we are trying to address the structural deficit, we're also looking ahead to 26, 27, where they implement the Behavioral Health Service Act, right? And there's no like preventative component in that, right? So there's early intervention, right? But there's no the prevention part was taken out, right, for BHSA, right? And so that's the other thing that we're like kind of seeing coming down the road, right?
yeah, in my simple mind, I always think of early
Yeah.
is preventative, but I agree, but it's not preventative in
Right,
that, and I appreciate that distinction. Yeah.
Is there a multi-department grant writing team for the county? Because I know in 2018, that time that there was one, Supervisor Provenza was driving the intercept mapping for criminal justice involved individuals. And out of that was a grant writing group with multiple departments, and then that group got a lot of grants, and it got disbanded because it was so successful, and they had to implement the grants. I don't know if the county's doing anything like that right now.
Not to the best of my knowledge.
Well, I would say not multi-department. I mean, I think it's more on the individual department
Because
basis.
the departments went through, identified grants, and to work as a team.
But I think your point, or the thing, the comment you made is also really well taken, which is that the success is a double-edged sword. I mean, it's great to get a lot of grants, but you have to have the staff to actually implement them.
Yeah.
And that's a real challenge, so, and for every local government. So,
I think the other challenge with the obtaining and implementing grants is that the cost of implementing the grant, you're not always able to fully capture with the funding from the grant, right? So the grants typically have like a 15% overhead cap, and sometimes your overhead can be more than 15%, right? To be honest, right? So, part of it is you end up incurring the cost when you're obtaining the grant, so.
I was in the DA's office, we didn't, first article ever go after administrative costs, we implemented everything into the services, and we just sucked it up, I guess.
But that's the dilemma, right? It's like you end up sucking up costs, all, depending on who you grant you.
You have a motion, or do we?
Did you need a motion?
Yeah.
I would move to give the executive committee authorization to rewrite the letter to the board based on what they approved today.
Second that motion.
That the language you wanted? Okay.
Thank you. Those in favor?
Aye.
Anybody opposed? Please.
I agree.
Thank you.
You're
All right.
welcome.
All right, motion approved. All right, thank you, everybody. All right, Supervisor Ferris.
Yeah, so I mean, it's kind of a continuation of some of particularly this topic I think we've been talking about a little bit. So appreciate that motion, certainly be sure to highlight that for the rest of the board members, and I know we will receive a letter from you all, but thank you very much for that. I think, so, a few points, in addition to the items that were discussed around the board's sort of discussion around increased Medi-Cal billing or looking at outcomes data. I mean, those are a few of the items. One of the, I would say, two other points that I think that we raised in June during that discussion was around the preserving fund balance. I mean, I think, so not going to sugarcoat it, right? $26 million projected expenses, $15 million revenue, right? That's the challenge. And it's going to be very, 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 very challenging to figure out, sort of, especially in a situation where I think most of us try to approach this type of work in a do no harm, kind of mentality and ethos. And I think we're kind of in the do the least amount of harm position right now, or hopefully the least amount of harm. No one wants to be in that spot, but I think we're going to have to sort of, so we'll see, we haven't seen a proposal yet from the staff, HHSA staff about but we have kind of assuming that it's, not going to be pretty. But I think 2 points that we also made in June were around, again, preserving fund balance. So, the key is we could probably have a pretty decent budget for this 25-26 year if we exhausted the fund balance that exists, but by exhausting it entirely in the 25-26 budget. But the board was pretty adamant about not just stemming, just stopping the bleeding for 1 year. We got to figure out how to try and, gradually have sort of some amount of money, use some of those dollars in 25-26, and then use some of those dollars in 26-27 allows us a little bit of additional runway and preserve some of that fund balance to help sort of get us through the next couple of years. We do have some challenges that are a little bit unique to YOLO, certainly in this regard, but also a lot of local governments or school districts, cities, counties, but certainly the counties around the state are having very, very similar challenges right now. Especially as it relates to this shift over from MHSA to BHSA. Obviously, county is just trying to, implement the will of the voters. And so that's, can be a bit of a challenge. I think one of the real, as we shift though from MHSA to BHSA, one of the real challenges is like the discussion earlier around issue of prevention, early intervention, right, was discussed. I mean, that kind of disappears in this new regime. 30% of the dollars are supposed to go to housing interventions. There's still a lot of questions out there that exist about what that means. I mean, there's reasonable interpretations of what that means, but basically a third of the BHSA money will be spent on housing interventions. It could be, I believe some of the acceptable expenditures are just subsidies, rent subsidies and vouchers and things of that nature. So that's positive, but it just really, there's a real dilemma around the issue of prevention and early intervention. So that's a challenge. And so we're really got to try and have to work through that as well. Again, across the state, not just YOLO, all the jurisdictions. I also, one last quick point, I would just say, appreciate the motion again. I think, there's a lot of talk about organizations doing increased Medi-Cal billing, which is important. But I also think there was a discussion about the county doing more Medi-Cal billing. It's not just the outside nonprofit organizations that exist in the community that might need to be doing more, or the school districts, for example, as part of like the K-12 schools partnership, but it's also the need for the county to be doing more. I think that was part of our discussion as well. So I just want to make that point. I'm happy to have more of a dialogue with you all. And the last quick item I would just say is also just, of course, and you've heard tonight a couple of times about the NAMI Walks event, but I'm very excited about that event. And I'm fortunate enough to sponsor it again this year myself and be participating on the Sunflower Power team. So that's another, but it'll be great. And really, really hope everyone is able to join us and participate. So, but just wanted to give that sort of additional update from, I would say, the couple points that were just sort of supplement what Tony had already discussed. Thank you.
Thank you, appreciate it. All right, move on to the ad hoc report outs.
Can I just, I'm sorry, Chair, can I go back on,
If you
just very quickly on item K, grant, Prop 47 grant update? So, Tony, I'm not sure if you're aware, but we didn't get recommended.
I just heard
For the
that
grant?
at the beginning of the meeting.
Yeah, and so that's really disappointing. Not to assign blame, but it's really disappointing. But I think that is all the more reason why, that was to be used for Prop 36, and that's all the more reason to be really taking a hard look at the opioid settlements for funding Prop 36. So I just want to put that out there.
I think on the Prop 36 thing, individuals who are not Yolo County residents and who are not on Medi-Cal are going to be in Prop 36. And I think with the difficult budget, I'm not sure how the board can support funding Prop 36 that way. I just, we have talking about cutting early intervention. How do we justify Prop 36 on a Sacramento resident? I support Prop 36, but I don't see how the county is going to be successful or find the funding for that.
Has BSCC actually officially, is that a public state position from them so far in terms of their recommendations?
Prop 47,
It's so they haven't voted, but here are the recommendations, and Yellow's not on it. So other than the Office of Education is recommended for it, but not our grant.
Historically, they've always rubber stamped the recommendation.
Yeah.
I haven't seen one where they haven't approved the recommendation, of better terms.
It must have been.
Well, what I will say to you, Chris, is that 70% of the voters want to see Prop 36 happen, where we could send people who are seriously ill and not willing to engage on a different pathway rather than prosecuting them and putting them in jail.
I agree.
And
so it's a state funding issue.
So it's not a state funding issue because there's no state funding. And the governor has said, Lucas, find the money. That's what the governor said.
Yeah, counties.
So I just want to put that out there. And I'm sure our board of supervisors will have, be weighing in on that too, but just something to just consider when you're looking at that increased funding. I don't know, $350 a year isn't all that much, but I don't know how much more it's going to go up to. So I realize $350 sounds like a lot, and it's not really. So, but if it's substantial, then it's just something to consider.
It also funds like multiple things.
I know. It's not a lot of money, but I don't know how much more. When you said it keeps growing, I don't know what that means. So
part of the challenge with Prop
it's not going to be 10 million a year.
No, it could be millions.
Yeah, part of the challenge with Prop 36, aside from the fact that it was an unfunded mandate, is that it's hard to get an idea about what the actual demand is going to be, right? You know, we haven't had a whole lot of cases locally, like we've had individuals who have been offered it, but then just choose not to accept it, right? But then, you know, what we're hearing is that, you know, initially people will refuse, and then, you know, a couple more court dates, and then they might agree, then they may agree to it later on down the line, right? And we're also hearing from the district attorney that they're trying not to overwhelm the system, but that if there was funding, that they would probably file more of these Prop 36 cases, right? So, you know, part of it is, you know, to your point, Jonathan, you know, are there some alternate funding sources out there that we consider? But then how much are we really gonna need? Like, what is the actual true demand? And, you know, to your point, you know, how many of these individuals that we're likely to be serving that don't have Medi-Cal or aren't even Yolo County residents, and so on and so forth. But, you know, I think we're going to have to come back to the table with district attorney's office, public defender, probation, to talk through another strategy, because I think we were really counting on getting the grant. That was what we were hoping. And with it not happening, we're gonna have to try to figure it out again.
Thanks, Jonathan, for the update. Appreciate it. Thanks, Tony. All right, well, on that news, you want to give an update on the ad hoc committee?
Oh,
Your recommendations?
we're meeting right after this.
Oh, you are?
I've gotten,
Okay.
4 of us, Dee, I thought Dee was gonna be here, but she's not, so
She's not part of the ad hoc.
I talked to her, I thought,
Oh, maybe since I talked, maybe she changed her mind since last time. I won't speak for her.
and so we were going to do, you need to appoint a chair, I guess. I saw TBA on that. 4 of us review the previous documents because they need to be updated. We're going to come up with a list of sites that we were interested in looking at, and then come back to the board with that. It's an ad hoc committee. I don't think we need a vote to change the guidelines for the business. The chair and executive committee can do that in between. So we're going to edit that, send it to the chair and executive committee to approve, and then we'll go forward with that.
Good, all right.
So.
Chair, or just, who wants to chair the committee, ad hoc committee?
We were talking, do we even need a chair? We haven't even decided if we need one.
Okay.
We'll make a recommendation
Make a
for you.
recommendation and get back. Okay, sounds great.
But some of us are new to it, some people are on it longer, and I don't know the time commitments for people.
Okay, sounds great. Appreciate the update. Okay, Kimberly, you want to update on the?
All right, so with the annual report, I contacted Teresa Comstock, who is Director of California Association of Local Behavioral Health Boards. And I kind of was looking for contacts from other boards that have done an annual report recently. So I got in touch with the kind of person who helped author that with Napa County, and I'm working on kind of getting connected with San Francisco County. So then trying to get contacts from like other counties that have completed this in like very recent times. Because while there's like examples on the Association of Local Behavioral Health Boards and websites, like a lot of the components kind of vary from county to county. And I'm trying to figure out like what components exactly would be relevant for YOLO. So I have that in the works. We already have kind of like a working outline with some of the recommended components. And we've also worked on compiling data, and the annual report committee, which is Meg, Sue, you, me, we have a standing meeting every week this month, and we hope to have like a working draft by October for the board to review. And then we're hoping to get like the final draft approved in the December meeting, because there's a meeting in November. So that's kind of the progress on the annual report thus far.
Great, thanks, Kimberly. Appreciate it. Okay. So end the public comment. So we adjourn.
Good evening, Jen Boucher Dancer, Executive Director, Yolo County. I just wanted to provide a little bit more context to our request for this board to support funding our contract at the level we were expecting this year. While we absolutely recognize that with Prop 1, the changes that are going to come in the following fiscal year are going to make the funding situation even more challenging than it is this year, which I can't imagine what that's going to look like, how you can get more challenging, but, and one of the things that we are asking for the Board of Supervisors to consider in fully funding our contract this year is that, like all of us, this was not news that we had been preparing for, many, many months. And so even knowing that next year's funding under BHSA will likely mean reductions for NAMI, fully funding us this year allows us more time to develop additional revenue streams, which we are working on. But one revenue stream is not going to make up nearly $200,000 in funding for us. And so it's complicated for us as well. And so that's just one piece that I wanted to bring that context to this board in terms of, why we are asking for fully funding to also allow us to have time to continue to build additional revenue streams.
Thank you. Let's see any hands online. Anybody's commenting? Okay, great. All right, before we adjourn, I just want to say thank you. Thank you to the public for all the comments. And Jill, thank you for your presentation. Or sorry, Julie, I went to school with the Jill Freitas. And now I renamed you, just so you know. Thank you. And just want to thank you to the board members. Kimberly, you have something?
Can I bring up something kind of as public comment? Or, yes?
Sure.
Okay, so I'm not, this is kind of something anecdotal that I've just kind of heard rumblings about in like SAC-NAMI, NAMI kind of consumer community. But essentially, I think beginning of this year, SAC Sheriff announced that they're no longer responding to mental health calls. And then for the most part, no longer providing transport for that. And the exact details of that in their policy, like I'm not entirely aware of, but it just like anecdotally in the consumer community, there's already kind of, I guess like some impacts around that with people not getting care at lower levels, people not getting put on holds at lower levels. So then they're essentially waiting until a crime is committed before responding. So then I guess there's just some concern there. And I know it's not our county, but sometimes these practices kind of like start bleeding into other counties. So I think it's just something to be aware of. Yeah.
Especially if we have Yolo County residents that are being served in Sacramento. I have a loved one that's ended up, should have been 150 multiple times, and it didn't happen. And so she ended up getting violated against because of her vulnerability. So that's a two-edged sword, double-edged sword, I should say.
Yeah, but
yeah, I'm really upset about that. Just so you know.
So essentially, what you said about like your family, like that kind of thing has been happening across a lot of consumers, like in Sacramento, and then there are people that come like in multiple, like between multiple counties, so that situation is kind of impacting them.
Well, sheriffs and chiefs are in a tough spot because no one else is willing to go do that job. And I mean, go out on a call when there isn't a crime committed, which is really, that's the role of law enforcement when crimes are committed. And so, and as we all know, when people go out in uniforms with guns, bad stuff happens and things escalate often at nobody's fault. It's just when you have someone very ill and they're in a psychotic state, things don't always go well. And so I have very mixed feelings about what the sheriff is doing, but I understand what he's doing in terms of, and there was a new case law that came out about the liability for his deputies when they go out and something goes bad. So on one hand, I understand it, and I think his view is someone step up, let's figure out who should be doing it. Certainly if there's a public safety issue, then they'll go. But so there's a little more to it than that, but and I've been working with a mom in Sacramento that's dealing with that situation and no one will come out. So I totally understand what you're saying, but it's a little more nuanced. There's, than just they decide not to go out.
Yeah, my approach is kind of like looking at consumer experience and fundamentally like, I know like there's ideal solutions that might not happen, but my kind of where I'm coming from is like, how do we serve consumers now? Because there's people suffering now, like because of decisions that have been made at a higher level. It's just like, because I think when a lot of these decisions are made, who suffers fundamentally is consumers. So
what I can say about this is that, first of all, Sacramento County is like 7 times as large as Yolo County, and it's a completely different set of circumstances that they're working with, and, you know, it's not my place to criticize the sheriff of another county, right? We had positive relationships with all the law enforcement agencies, you know, I mean, definitely there are times when there's like a little bit of tension about a specific thing, but having the co-responders, even though there is you know, there's some controversy in there to some degree, it's been overwhelmingly positive, right? In terms of the opportunity for us to go and work with their officers through CIT training, and for them to have, you know, someone that they've been able to develop relationships to go and respond to some of these calls. We also have our mobile crisis response team. And ultimately, if there was, for some one reason or another, if there was a law enforcement agency who was telling us in Yolo County if they would no longer respond to a mental health call, we would still have a duty and an obligation to respond. I think that the bigger challenge, and I don't know what Sacramento County's sheriff's official policy is around this, but you know, what we've tried to get to a place to with the law enforcement agencies is like, we don't need you to, you know, respond necessarily. Like, we don't need you to go and get involved and engage. But, you know, in certain situations, like, it'd be helpful if you were, you know, kind of there, you know, like making sure it's safe for us to go and do what we need to do. But once the scene is cool and we're able to be there, then law enforcement doesn't really need to be involved. And I think that's what everybody wants. I think law enforcement doesn't want to be in that situation where it's like, if there's no crime being committed here, I don't really need to be here. A lot of clients get escalated when law enforcement's present, right? So it's a better situation for everybody if they're not there. But, you know, to your point, we haven't heard anything from any of the law enforcement agencies in Yolo County saying that they were planning to follow suit. And I don't know. I don't know that there's any plan for that to happen, but if it was ever to come up, I would certainly bring it forward here, if I was to hear something like that.
Yeah, I just wanted to kind of bring it up for
Sure.
people to be aware of, because again, like sometimes things that impact like adjacent counties could potentially like impact clients here. So yeah, I appreciate your response.
Yeah, no problem.
Yeah, so
I was just gonna ask, are you saying that, and when you're working with law enforcement, you mentioned Sac County, are we still working on, I heard that there was some conversation with our sister county to be able to cross county lines to assist a person, so is that what I kind of hear you saying, that?
That wasn't necessarily what I was referring to, but we have been trying to figure out a way, like, you know, for certain situations, like where we've had Yolo County residents who were in Sacramento County for whatever reason, and just trying to get authorization for our staff to be able to go into another county and do a hold. And so we've had some conversations, and we've had like at least one of our staff has been, you know, authorized to do that, you know, but we haven't had like a large scale conversation around that.
Well, that's impressive.
Huh?
That's impressive.
Yeah.
That, I mean,
I
that's,
think
yeah, because like, 8 months ago,
Yeah,
7 months ago, that didn't happen.
I remember. Yeah, so what we are working on it, but I also don't know that the degree with which it's an issue right now.
And I'm not even with our county, there's, you know, all the other counties that surround us. I know that a lot of our participants, clients end up in other counties as well. And so it would be nice if the counties would come together across the state to be able to implement all these services with all of the new changes that are happening, especially SB 43 as well.
It can be difficult for the counties to coordinate on some of those things, but you know, we do our best with that when those kinds of things come up.
Well, I think what's funny with me is that the reality, whether it's the police who show, whoever responds, is that there is a significant change in process or procedural, and there's a unilateral decision that then impacts other services. So I'm not sure what happened in Sac County, I'm not saying that, but I would hope what I'm hearing you say, Tony, is that there hopefully wouldn't be a unilateral decision made by a law enforcement agency that would impact services provided so greatly that it would make it so it's not clear who's supposed to respond.
So I don't anticipate a law enforcement agency in Yolo County making a similar decision, but I mean, if they did, it would be a unilateral decision. I mean, we can't compel them not to if they want to take that position, right? But I guess what I'm trying to say is that if for some reason that were to happen, we would still have a duty to respond. Yeah. But that would really complicate things for us. Let me put it that
And there
way.
would still be a gap while you were figuring out how to respond to that gap, right? So I guess the question is there anything this board can do with respect to reaching out to the Yolo County, or to the sheriff or not, or if that's even appropriate, just to say, you know.
I think we'd be getting ahead of ourselves if we did that, but, you know, I'm happy to follow up with each of the different chiefs and the sheriff over the course of the next few weeks and just confirm that nobody's thinking about doing anything like that. And then I can come back and let you know.
Yeah, I just brought it up just for people to be aware of, because I think when I, like the, how do I put this? Like, yeah, kind of like what you said, I haven't heard anything about like law enforcement doing that in Yolo. I just brought it up as something to be aware of that's been a concern in several other counties across the state.
I'm not asking, you have so much on your plate, you don't need to.
That's-
you don't have to. I guess what I'm saying is what I hear you say is that, through the grapevine, potentially, hopefully you would hear something, rumbling, something.
And don't have that conversation, don't plant any seeds.
It's all good.
Yeah.
All right.
What I say is that having co-responders has been really good for our relationship with law enforcement, right?
Yeah.
So, yeah.
All right, thanks everybody.
Thank you.
It's a lot of money. Rated number one, rated number one. So I'm just like.
Yeah.